Hassan Sadri here, ophthalmologist in Newport Beach, California, here at OIS, AAO in 2019, San Francisco. The weather's clearing up, and I don't need to tell you who my next guest is. He's a legend. He's what I call one of the GOAT Mountain, the greatest of all time in ophthalmology. He's one of them. He's a legend. Mr. Jim Mazzo, a good friend of mine. Jim, how you doing?
That's very nice of you. I'm doing better now that I'm seeing you, pal. How are you?
It's true.
And you are looking really good today.
Thank you.
You're
So
really
are you. I love the outfit. This is
Thank you.
very stylish.
Thank you.
Tell us, Jim, obviously you've been industry leader for so many years and so many different people you've mentored in Orange County, and here we are in San Francisco. Tell us what's exciting about your newest thing at Zeiss, because you're doing a lot right now. And I'm a recent customer. You don't know it yet. But,
Thank you.
But so tell me about what you're doing.
So, you know, we've known each other a long time. You've been, even though you're a young guy, you've been in this industry for a period of time. It is a paradigm shift now. What we're creating, or have created and doing more so, is we're flipping the whole equation to where the data, digitalization, is the critical nature of what's happening in the practice, and the products that support it are really the vehicle to get you the information. Here's a situation you know. Less practitioners, more patients. You just cannot provide the same amount of time like you did 3-4 years ago.
Agreed.
And your patient is saying, hey, I don't have time. You're going to see me at 2 o'clock now. They're not sitting in the office saying, hey, I'll meet you when you can. So there's a lot of demands on your time. So what we need to do as an organization is to provide you the data that you can make a very educated discussion with that patient prior to going in.
Okay.
And so what we're doing is we're flipping the equation with the forum, with EQ Workplace, with Veracity, making you and your colleagues more productive to be able to have the data at hand. I've always said, he or she who owns the data will win. So if we can provide you better information through all of our multiple disciplines of our product line, our diagnostic, our surgical, our refractive product line, and then you have that at the tip of your fingerprint, you're going to be much more successful. So we really are flipping that equation to where digital is becoming the forefront of what we're offering, and our products will be there to support you.
Yeah, I mean, I got to tell you, I was at ESR, spent some time with your engineers. Pretty impressive.
Yeah.
Break it down for me a little bit. So here we are in 2020, refractive IOLs are taking off. I know you have trifocals in Europe coming down. I know you have that. So you're excited about the digital content and, more importantly, data in our practices.
Right.
How does that impact that refractive IOL business that we're in and we want to grow? Does that influence that, or is it just more for higher efficiency and flow because we're getting paid less? Does that efficiency make us better just seeing more patients, or can we do a little more on the boutique side too?
Well, actually, it's a great question. So think about the refractive IOL. It isn't for everyone.
Correct.
Not because of the technology, but every physician should be doing an OCT on the patient.
100%.
If you do an OCT, you'll actually have a better result. So let me carry you through the digitalization. We're the world's leader in diagnosis. If we can have a proper diagnosis through OCT, this will tell you if this patient is the right type of person. Second, what's the number one issue you're facing is dry eye too with your patients.
Absolutely.
And that's impacting the great technologies that Zeiss and my competitors are coming out with. But we should understand that from a digital standpoint, what's happening on their tear film. So if we have a good OCT, if we have a good imaging of their dry eye, refractive IOLs will increase, even with the current technology. But we're kind of throwing darts at it, hoping you're a good refractive patient. Then you come back with a problem, and then what happens? Your peers say, I'm not touching it.
Correct.
So we want to be proactive in measuring, thus you will have a greater success with those patients, which will increase your confidence and drive refractive IOLs.
No, I agree. I mean, take me through this whole reduction in the payments in CMS. All the more, right? I mean,
right, all the more, most definitely.
I mean, we're in a $400, $500 range, which is ridiculous.
Right, just, which is disappointing to have to sell. You have a tremendous gift. I mean, I still get shivers. This is my 40th Academy. Okay? Why do I still love it? Because I get to deal with people like you who do something unbelievable every day. You help people see. That is really cool.
Yes.
But you're getting challenged on your reimbursement rates. And you have a young family, you're trying to make sure you be successful, you've got younger people coming in. So we need to have a good blend between the reimbursed and the non-reimbursed.
Correct.
But the non-reimbursed has come under a lot of constraints because of what we talked about. You don't really know who's the right patient. It's easy on a reimbursed cataract procedure.
Sure.
You're just picking which lens, et cetera. But on that refractive IOL, that patient pay, people are hesitant because they don't have all the information at their fingertips. That's why we're shifting it to have you have that information at your fingertips.
So okay, so I'm going to pivot a little bit.
Sure.
Put you on the spot. You got all this responsibility at Zeiss. You're global. Everyone's got finite resources. Where are you in 3 to 5 years? Not you personally, but Zeiss. What's your vision?
At Zeiss?
Yeah. Because I know right now you're mostly diagnostics.
Yeah. I would.
What's your legacy going to be? Is that going to be IOL full spectrum like you did at AMO, or?
Well, first off, we've had 3 tremendous years. My team has done a great job. If you saw the stock has done extremely well. So we still have some, always as a company, to do things better. I still want to make sure our service, our customer orientation is better, because at the end of the day, we've got to make sure you're happy and your patient's happy. So we're still focusing on improving service. We're never going to stop that. That's got to be relentless. Relentless service is number one. But I would tell you that what I hope for in the next 3 to 4 years is that every piece of Zeiss equipment that you have is talking to each other. So that when you put them through an OCT and you move them into our soon-to-be new phaco, or move them into a Vizumax, smile procedure, you have all that patient interconnected. I don't want to see a piece of paper in your hand anymore. I want that to all be online, so that you can make a decision right there. So really, in the next 3 to 4 years, I want that workplace being efficient. The other one, I don't want every patient to have to be in your office. Why should a patient who's 85 sitting in a nursing home, why can't we help provide resources to them to do a self-diagnose, to download to you at 6 o'clock at night when you're done with your practice, and then you call Mrs. Jones and say, Mrs. Jones, don't need to come in, you're looking good. Why do Mrs. Jones need to leave that nursing home and sit in your office?
Right.
Waste your time, waste her poor time. So I want to be able to be proactive and help the patients that you see maybe decide that they don't have to come in and do some self-diagnosis with your great understanding of what they have.
So that would be more of a consumer-led or a more facility-led?
Well, I think, I guess the answer is yes.
Yeah.
Because we want to have the facility where the consumer is. But then eventually one day be it at home.
Yeah.
And I'm not talking using the iPhone. I'm talking about really having something that you would feel confident on.
Sure.
But we cannot afford patients sitting in your office that really don't need to be there.
Absolutely.
You can't afford it. It's too much a drain on you, and it's really an imposition for that patient.
The patient, right. Very good. Okay, so now we're going to pivot one last time about careers.
Okay.
Take me through, you mentor a lot of people, because I know you've mentored me.
Thanks.
You opened a lot of doors for a lot of people. Most of them are actually in here. But I don't see that from everybody, from leadership. You're very unique in that sense.
That's very nice of you. Thank you.
No, it's true.
Thank you.
How do you create more Jim Mazzos? How do you do that?
Well, I don't know if we want any more Jim Mazzos, but I guess...
Well, Kelly would definitely want
Okay,
that.
Kelly does it. Yeah, poor Kelly. She's got more than one. Just one Jim Mazzo. I guess what I would sit there, and I go back to the person that had a huge influence on me, is Gavin Herbert. 40 years ago, he brought me into this world, and I still believe that philosophy is what's created whatever success I've had, and that's by staying close to the customer. I really mean that. He has said that you can never make a decision while you're sitting in your office or sitting in a meeting. The only way to understand our business is to be in the field, in the OR, in your practice, helping understand what you're saying. Because he taught me a very valuable lesson. There's a difference between active and passive listening. Passive listening is I'm on the phone with you and you're telling me what you need. Active listening is I'm in the OR watching you, hearing your interaction with your OR nurse, talking to your OR nurse, talking to your tech, talking to the front office staff. So I would tell you that the reason I would tell people and what I mentor them is, I don't care what your position is, you never stop going in the field. And the other thing, 2 ears, 1 mouth. I know that's hard for an Italian.
Yeah.
That's hard for an Italian.
That's a famous line
but
of
I
yours.
will tell you, 2 ears, 1 mouth. Listen, 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 because we get very minimal opportunities to spend time with you. You're very busy. And we need to make sure we're listening rather than telling, because the only way to grow this. And then at the end of the day, I will just also tell people, I absolutely love what I do. I get to work with unbelievable people. I get in my team, Andy,
It
Lori,
shows, yeah.
and I've helped bring people in, and I get to work with you. So if you don't have that passion, move on, get out. Because it's not fair to you as a customer if I don't have as much passion or more passion than you do.
Yeah, but I mean, some of that spirit has changed. Like, I think that there's a shift, even ophthalmologists that are coming out, they want everything done yesterday.
Yeah.
How do you deal with that when you're hiring?
And the industry's changing too. I mean, there's a lot of people that don't know that there's not an F in ophthalmology walking around here.
Right.
And that concerns me. I will
Absolutely.
tell you. I will tell you that this industry is very different. I'm a med tech specialist. I've run AdvaMed, where I have all the med tech companies. I'm not saying we're better or worse, but the intricacies between the practitioner and the companies are far closer than any other. I think where we've had misses in this industry is they don't get it. I think where you've seen bumps along the road where companies have been acquired and they haven't been successful is because they've taken that person away and say, oh no, you don't need to be spending time with the customer, sit in your meeting. That's been lost, and I think that's where the problems are. We've lost that intimacy.
Yeah.
We really have lost that intimacy, which concerns me. And one other thing, we've got to continue to invest in the resident. They're a nonprofit making institution. You're not going to make the money off of them, but you've got to invest in their proper training today with them. And I think that's also been lost. People have pulled away from residency programs.
Yeah, it's always that balance. Very good. Well, it's an honor always to see you, my friend.
You're a good man. You're doing great. I'm so happy you're here.
Pleasure.
Well
Same
done.
here.
Thanks, pal. You're looking good.
Very good.
See ya.